I'm Alastair. I'm the director of Genetic Alliance UK, which is an alliance of almost 200 patient support organisations for families with rare and genetic diseases. The 100,000 Genomes project, and importantly its translation into clinical service practice in NHS England, is a hugely important venture because it will give us, for the first time in our history, the opportunity to understand a whole range of rare, devastating conditions that up to now we haven't had the tools to investigate, we haven't been able to give much information to patients and families, we haven't been able to support the research that will lead to the understanding, to the development of therapies, to the possibilities of intervening in ways that will improve the quality, the quantity of life for the hundreds and thousands of families who are affected by these rare diseases. Getting results gives information, it gives the opportunity to understand. If you have a child or a family member who has clearly got a serious illness, but nobody can tell you why it's happened, what it means, what the future holds. Will it happen again if you have another child? What does it mean for your relatives? You know, if you're in that situation, you're in the dark, you're pushed along by circumstances that you have no opportunity of trying to take control of. Getting a result at least means that you can begin to understand. You can begin to ask questions. You can find people who are in the same situation as you are and learn from them, peer-to-peer support. You can create the opportunity to do research and ultimately, possibly even, to develop therapies or interventions that will change the course of the disease.
My husband and two sons have been diagnosed with a rare genetic condition, and it's important to try to get some results from this project so that the third son can be genetically tested to see if he is susceptible or not, and for the future potential children of the whole family and the wider family. I think the project will gather momentum, and I think it is the future of medicine, both for rare diseases and for cancers. It just holds the key to everything, I think, genetic testing.
I thought it was very important as a scientific project. I didn't realise when I was looking at it that it necessarily applied to me, but when I read through it, I thought, I've got a rare condition, and that's just what I ought to try and get involved in. So I wrote to the researcher and said, does this apply to me? I've then been through the process of having blood taken and waiting the result. The results might mean that clinicians can identify a more precise treatment for the condition rather than chemotherapy in large quantities, which may or may not necessarily solve the problem. It's a temporary relief, whereas something which is specific might have more long-term effects. My family, I think, would be delighted if there was something which specifically helped me, because they know that I have increasing difficulties in breathing and walking, and I'm more limited in what I can do, and that they realise that it's a condition for which there is no cure. So if there is something which is more helpful in terms of relieving the symptoms, if not curing, but ideally curing, then they would be, I'm sure, as delighted as I will be.
I joined this project because of my daughter. My daughter is 4 years old, and when she was 8 months old, she was diagnosed with a very severe type of epilepsy called West syndrome. It caused a lot of brain damage, and we were told at the time that only time would tell whether she could walk or talk in the future. So she was enrolled in the project to try and understand why she was ill, and of course one of the most important things is to know whether subsequent pregnancies will result in the child with similar difficulties. The results will be important for a number of reasons. It's difficult to put into words what it means for a parent when you find out you have a child with severe disabilities. You often think you're guilty for producing such a child. So we would like to know if it's just a natural event that's happened, or whether it's something else. And of course, this will help us to plan for a future family. But also, it will allow me to inform my daughter when she's able to understand, if she's able to understand, why she is ill and why she's so different to other children and people like her.